Dr. Joseph Williams is a doctor of education at KCU Joplin.
And Dr. Williams joins us today to explain how artificial intelligence is affecting medicine and changing the way doctors care for patients. Thank you for being here with us today. I've enjoyed just talking with you in the break room a little bit about this, because you really put it in layman's terms to make it simpler for all of us, because a lot of people are afraid of this, but it's really changing the world, and there's so much good in it, isn't there?
Absolutely. It's a fast-paced world out there. You can't turn on TV without watching a commercial to hear about the latest and greatest AI venture or the AI integration into your favorite software or the pharmaceutical industry and things like that. We just wanted people to know that we're trying our best to provide the physicians of tomorrow the training that they need for the AI that they're going to see in the clinics.
And this is kind of a revolution in healthcare. So when did it get started, and how specifically have you seen this add something to your
practice? KCU is truly one of the leaders in the entire country when it comes to teaching AI in the actual curriculum of a medical school. I spent about 2 years asking every question, whether it was at the Ivy League or the big schools, how they were doing this, and no one had really a great answer. And so it was time to forge our own path in a way. I think a lot of it is kind of in the way of the Intercontinental Railroad and the Golden Spike. We've got some amazing things that are happening in Silicon Valley, very much on the coast, but we want to make sure that we're going to meet that moment, and we're going to try to do the best we can with doing that.
And this is really helping doctors and future doctors make smarter and faster decisions, isn't it?
Absolutely. It has an enormous amount of potential. And one of the big things about this, too, is that there's just a lot of questions that still need to be answered. We don't know exactly where this is going to go. AI changes month to month, day to day, sometimes at its current pitch. We want to provide a foundation so that our physicians and the clinicians of the future have a tool set that they're going to be adaptable for just about anything that they might come across, not just for a singular tool.
And it seems like if you're not on this bandwagon, you're going to get left behind very, very quickly.
It's possible. It's possible. We don't really know, again, exactly where it's going, but we want them to be prepared. And the idea when we think about providing the care and the well-being of the communities that we serve, we want to make sure that they're ready for any task that they're going to come across. And we know that with system adoptions of these types of tools, with further reliance on data, which these tools are really, really powerful at using that and leveraging that for the good of the patients, we want to be there at that moment so that we can capitalize on that and not be falling behind in any way, shape, or form.
And there's a lot of misconceptions about this.
Oh, wildly, yes. They talk about AI taking jobs and AI, and the idea of what that point of care is actually going to look like. In reality, what I think this is going to do is that this is going to relieve some of those logistical burdens so that we can actually let physicians be physicians, and that they can provide that care that is second to none, that warm hand at the bedside, that empathy and that care that a machine will never be able to provide, as well as that critical thinking that while these tools are really good at some of those things, a physician will be able to see that full picture in the moment with those people at the bedside.
Can you provide any specifics as you've gotten interested in this and you have studied this, interesting specifics that you see as happening in the real world?
Sure. So they've actually coming out with some of these models now that they say that they can actually outperform physicians on certain diagnostics, which it's true in a bubble, right? You have to tee these things up. You have to provide the data set. You have to provide that information for that tool to ingest it just right. Is that what the real world's really like? No, right? It's a little bit messy. It's a little bit dirty. There's always the ifs, ands, or buts. There's those new conditions. There's that new care, that new prescription that my mom forgot about to tell her doctor or tell her physician that what she was thinking about or what she was taking. And we need that dynamic ability to work together. So while it does have power to increase the diagnostic capability, again, we need that flexibility of the human in the room. And we want physicians to be part of those conversations, right? Again, because there's so much still to be learned about its implementation and its development, is that we want human beings in that room. And we want people with tremendous amount of medical knowledge, like they're providing at KCU, to be part of those conversations on the daily.
So there's not so much to be afraid of as there is. It's going to free doctors up to have more of that bedside manner,
Absolutely.
Which is so important.
It's so exciting. I think about it in the sense of that, what types of tools would I want my family to have? I want them to throw the kitchen sink at it, and whether that's a diagnostic tool, whether that's going to be a data tool, I don't care, right? I want every single avenue to be explored when we think about the possibilities that are going to be there. And this is just another tool that's going to be able to provide that at a speed and possibly as well too at an overlaying layer that's going to be democratized. This is something that can be implemented in a relatively rural environment or an underserved environment just as easily as it can at a high level institution.
Has AI affected the way you think of healthcare?
Definitely, definitely. AI is really good at data. Right. The way that these things are created is that they take data and they effectively predict what should be happening next in the grand scheme of things. And so what that's done is that it's really shown how data is a living thing, right? But it takes context to provide that information. So when we think about that diagnosis for the physicians, that's that final piece of information that they're trying to communicate. There's 1,000 things that may have gone into that equation for them to get there. This is just something that's going to help them synthesize that to the best they can.
It is also interesting. And how do you balance this, the technology and the human side of this as well?
That's also something that we're learning, you know, and some of that we're going to have to learn as we go. Because again, this is one of those the few things in my academic and in my scientific life that's brand new. You know, this is something, and that's what's so fascinating and so exciting about it at certain times. This is a true frontier, and so we're going to have to learn. We're going to have to take some lumps as we go along with that. But like we do with most good science, is that as long as we keep asking good questions and following up with good answers, we'll do the best we can.
And I'll bet if somebody goes online and wants to learn a little bit more, they can go to your website.
Absolutely, kansascityuniversity.edu.
Thanks so much, Doctor.
Thank you.